Hi, everyone. Thank you so much for joining us. I am so excited to be here today with Dr. Sinead Dufour, and we're going to be talking about C-sections and how to heal your diastasis recti. What is diastasis recti? Sometimes you don't even know what that is. And anything related to pelvic health and C-sections, because there's a lot of misconceptions out there. And being a cesarean mom myself and going through my own experiences with pelvic health issues, I really could see the benefits of understanding what this information is and really how to help your body heal postpartum from the inside out. And so that we're eventually preventing, any issues down the road as we're aging and our bodies are changing. So hello, Dr. Sinead. Thank you
Hi,
so much for being
Nicole.
here.
Oh, thank you so much for inviting me to chat with you. And I just love what you're doing. And I agree. I think it's really important that people just understand kind of what's happening here. As you said, to be really, really, like recover well, but really promote and create kind of health through the lifespan. So, yeah, love that. Excited to chat today.
So tell everyone a little bit about your background. You have so many amazing things that you've achieved already in your young life. And I want everyone to know about what you've done.
Yeah, absolutely. So, at the moment, I am what I would call an academic clinician.
Mhm.
So, I kind of spend time at McMaster University. I teach in a number of the different schools under the Faculty of Health Science there. I also conduct research. And then I also, kind of more clinically, on the clinical side of things, I'm the director of pelvic health for sort of now more a family of perinatal care centers called The Womb, the World of My Baby. So we have a number of locations in Ontario, Canada now. I
Mhm.
run my actual own busy pelvic health practice. I'm a pelvic health physiotherapist out of our Burlington location. And then in addition to that, I very much do sort of in more of, I guess you could say, like a knowledge translation role, an advocacy role. I sit on a number of committees at the Society of Obstetricians and Gynecologists of
Amazing.
Canada. So I contribute to clinical practice guidelines and just kind of advocacy from that perspective. I
I
sit
love
on a
it.
committee at the International Continence Society. I'm on the clinical advisory board for Lanzano, which is like a breastfeeding company that is really trying to push more into the fourth trimester for trying to support women healing. I
Mhm.
teach for a number of different companies, teach postgraduate courses for fitness professionals and health professionals through Reframe Rehab, through BF Formations, and through Pelvic Health Solutions.
Mhm.
And I consult with a few other different businesses that are really all around trying to optimize pelvic health. That
Yes.
really is kind of my mission, is to kind of help as many different places as I can to really try to translate this knowledge to
Mhm.
support women. So yeah, I'm doing a bunch of things, but I would say what's important
Yeah.
is I am a mother of twins. I myself went through the journey of having a cesarean birth and really quite a
Okay.
severe diastasis and things like that. So in ways, it very much was my personal journey that got me
Mhm.
more interested in this area. My doctoral research and my postdoctoral fellowship research is actually more around primary healthcare, health promotion, system redesign. It isn't
Mhm.
having anything to do really with pelvic health. It was my own personal experience that kind of led me to
Yes.
pelvic health. But now everything I do is pelvic health. So yeah, that's a
That's
little bit about me.
amazing. I did not know that you were a fellow cesarean mom.
Yes,
That's
I
great.
am. Yes. Yeah.
I've been interviewing so many people this month, not even knowing that they were cesarean moms themselves. So I love
Yes.
that you have that personal experience that you can really
Hmm.
speak to people because you've been there. You know what it's like, right?
Yes.
So, and I also love that you are working with the College of Obstetrics and their association, was it right?
Yes.
Because I feel like the information needs to be given to people that are pregnant and having babies
Hmm.
from the higher up, which is their doctors, that they're
Yes.
listening to what their doctors are telling them. And if they're telling them only make sure your incision heals and don't lift anything heavier than your baby and don't drive for 4 to 6 weeks,
Hmm.
that's all they're going to know to do because they think,
Yeah.
okay, well, this is what my doctor's telling me. But if someone like you is in there and kind of feeding them the information, like there's research behind this. This is not just
Right.
like a thing that we've made up. There's tons of research. This has been going on for a long time. Different countries are making this a part of their healthcare system.
Yeah,
Why is
absolutely.
Canada so far behind? Because I feel like this information is so much, it has so much power to it. because the
Totally.
reality is people having babies and people giving birth in whatever way they do, they need the tools to help themselves heal. Otherwise, they're putting themselves further back on the list of importance in that initial fourth trimester. And that's really a critical time, right?
Yeah,
While the body's
absolutely.
healing.
Yeah,
So
absolutely.
can you tell everyone what is diastasis recti? What is abdominal separation? What's it all about? There's been so many, I find, changes in research in the last 16 years. I learned about it maybe 10 years ago, and now what I know about it is very different than what I knew about it back then. So can you tell everyone what that is?
Yeah, absolutely. So you're quite right. I would agree. There's been an evolution, which I think is actually positive, and we're kind of
Really
going
good.
in a good direction. But yeah, so diastasis recti, um, it really is. I mean, the term diastasis in Latin actually means separation. So this, in ways, actually is a little bit of the stumbling block, I think, of why the landscape is confusing, because the name of this health state, right? Because I don't
Yeah.
even really want to pathologize it, but
Yeah.
the label of this health state is really defined as a separation, even though there is no separation of tissue. When there's separation of tissue, that's a hernia, right?
Right.
So really, we're talking about a relative displacement of the superficial tissues and a thinning and a widening of the linea alba, which essentially
Right.
functions more like a tendon, right? And sort of when we have this relative displacement that is beyond a rather arbitrary norm,
Yeah.
we sort of label it as now we have a separation. So I mean, even
Okay.
really just how it's defined and what we call it
Right.
is actually
Yes.
quite unhelpful, to be
Okay.
honest with you. But that is
Yeah.
essentially, if we're being clear of what is it defined and what does it mean, we are talking about when the superficial abdominals relatively displace from one another
Right.
because of a thinning and a widening of the linea alba, which functions as a connective tendon between them. And when this relative displacement is beyond a certain criterion that we determine is beyond normal,
Right.
we then say now this is diastasis. So that's really kind
Okay.
of how it's defined. When we are in a situation where there actually is tissue separated, we have a thinned out and wide linea
Right.
alba. Now it actually has a hole in it, like it
Yeah.
actually has separated tissue. This is a
Right.
hernia, right? So
Hernia.
it's important that people kind of understand the difference. And really, what's relevant, and this is where it's been great that our understanding is shifting, is we're starting to think less of this thing in terms of the distance of those superficial
Yes.
abs. And
Yes.
we're starting to think about, okay, but really that's a surrogate measure, right? Really, what's relevant is what are the actual properties of that tissue that have thinned and widened and
Right.
arguably should sort of reorganize themselves back together. But for about half of women, they don't. Half of women
No.
they do, and it's no issue, but half of women they don't. So that's really the
Right.
question. So it's a question about what's actually happening in the tissue properties and what's actually happening not just with the linea alba, but kind of the whole abdominal wall. Because are there other things happening in the canister that are impacting the alba's ability to knit back together?
Right.
So really, that's kind of where we've moved in terms of a consensus across,
Yeah.
healthcare providers in Canada to understand, yeah, we've got to look beyond what we call the interrecti distance, that
Yes.
distance between the rectus abdominis
Yeah.
muscles. We have to look a little bit more at the whole body, a little bit more at the properties of the linea alba, and a little bit more in terms of like behavior of the tissue and function and intra-abdominal pressure
Right.
management, etc. So that's a
Well,
little
even
bit of
the
a
way that you
backdrop.
say it now, like with the new terminology, instead of using separation, say
Mm-hmm.
displacement, because
Mm-hmm.
separation would cause somebody to focus on the distance between.
Mm-hmm.
So just changing
Absolutely.
our language with it, I love that. I'm learning something right now.
See,
Just
there you
because
go.
because if I'm talking about it with patients, I want to be able to say it in the right way for them to understand that, because I am telling them it doesn't matter the distance between. What matters is the tissue underneath and when the linea alba is, right? Because I've found with palpating and feeling the linea alba post pregnancy is some people's linea albas are very strong. I don't sink down at all, and others I sink right down. I can feel pulsing. Like you said, sometimes people have an actual separation where there's a hernia, so you'll see like the bulging coming out, right?
Exactly.
So I love the way you put that. That's great. So
Okay.
so in regards to C-sections,
Yeah.
how does that look? Because I know with C-sections, they're cutting through all the layers of tissue, and then they
Yeah.
are physically separating the abdominal muscles during surgery. Does that cause any difference in healing the abdominal separation?
So what it seems, and this is where we really don't have like a ton of really good concrete data to like sink our teeth into in
Right.
fairness.
Okay.
But what it does appear, there are a couple of studies that highlight this. And certainly those of us who really work in this space
Hmm.
can corroborate clinically this is what we see.
Okay.
We tend to see a higher proportion of the abdominal wall that doesn't naturally knit itself back together when there
Right.
has been a cesarean birth.
Okay.
So certainly there is reasons for us to think, okay, well, why is that?
Yeah.
And it's possible that maybe depending on how the surgeon, actually performed that
Okay.
procedure, how
Okay.
gentle or not, and how much stretching of the tissue through that procedure was happening. It's
Okay.
possible. However, when we think a bit about it, where the incision is made for
Hmm.
the cesarean birth, it's very, very low. It's really
Yeah.
low down close to the pubic bone. And
Yeah.
actually, what we see much more often with compromised linea alba is it's above the belly button.
Right.
So we actually think it's possible, depending that might have kind of overstrained, overstretched some of those tissues
Hmm.
potentially, for sure.
Hmm.
But it's probably more likely that it's other mechanisms going on why these
Hmm.
women struggle. And
Right.
what we think is that because when you've had that cesarean incision, as you mentioned, it's 7 layers of tissue that are gone through. And
Hmm.
so people do get very focused on just kind of that scar and what it looks like. And they think it looks like this little line,
Yes.
but actually, it's a huge sort of circumference of
Yes.
fascia around that is very, very
Yes.
tight, that is
Yes.
holding excessive tension. And we know
Hmm.
when tissue is holding that excessive tension, it's not going to get vascularized as well. The peripheral nervous system function isn't going to be as good. And we know that the force transfer is not going to be as good, right? Just
Right.
can't transmit that load. And so, what we think is because of all that excessive tension, particularly if the individual is not understanding that there's a lot of value to address that, and I'm sure we'll get into that, we will sort of have likely this kind of mismanagement
Yes.
of force load and mismanagement of intra-abdominal pressure with all the usual tasks that a mom's going to do.
Yeah.
And then that's going to really explode consistently a lot of extra force around the
Yeah.
belly button. So that's
Right.
sort of no surprise that this tissue that's trying to organically heal, that's designed to organically
Right.
knit itself back together, I mean, it keeps getting these repeated assaults
Yeah.
and it just can't, right? So
Yeah.
we think probably more along that lines, but it's great. Like there's still a lot we need to learn.
Yeah. And so I'm in like the C-section world. Like since I've kind of very specialized in this in my practice and online, I only really hear from cesarean moms. And so
Right.
I'm not sure what the census is like on the other side with vaginal delivery moms, but the abdominal binders and corset type things that people are recommending to each other and potentially from some kind of, I don't know who recommended it, maybe a hospital in the States. I know they give those abdominal type binders after. And so I see that such a very popular thing is that cesarean moms want to kind of wear some kind of a binder or compression in their torso to help minimize the puffiness, I guess, on the lower abdomen. It's a lot of aesthetics, right?
Hmm.
And I'm more concerned, obviously, like you are, about function and preventing future problems. So, what do you think about these corsets and those abdominal binders, and what's really happening to their pelvic floor, to their abdominals as they're healing, thinking that they're compressing everything to minimize the look of it? What's it actually
Hmm.
doing to the function?
So, what I would say with that, because I think this is such an important question, and I'm so glad
Yeah,
you brought it up because it
yeah,
requires clarity for sure. So, first of all, I would distinguish between a corset and a
mm,
supportive, proper compression device, and they're two different things.
Okay.
And so actually we do have some decent data. In fact, there was just last week another pretty well done study in Musculoskeletal Science and Practice, which is a high impact journal, kind of supporting the notion of compression, but compression that kind of comes from the bottom up, that you're not corseting down. Actually, after cesarean birth, to assist with the lymphatic system, to assist with those pieces, right? And to provide even that proprioceptive sense of kind of being, you know, supported, so that you're not then self guarding your muscles all the time, which is just not constructive, right? So there actually is some data, but again, it needs to be the right type of a support. You know, the type of recovery garment that I like, it's actually a shorts, because it really provides, you know, the support from the bottom. There's no risk of kind of top down. It's from a company called SRC Health. They are based out of Australia, and it's medical grade compression. It kind of comes from the bottom up, and there's some, you know, good data to sort of support something like that. That is very different than a corset, just to kind of make you feel like you're not puffy. So I guess the first point is for people to understand, what is the purpose of a garment like that? And if there's a purpose, is to support your lymphatic system. And if there is a purpose actually to give you some gentle proprioceptive input kind of from the bottom up and not corseting down, that's shown to have some benefit. But it's shown to have benefits specifically when it's combined with activation and exercise. So that is the other key, is that just kind of passively handing someone this and not saying, we want you doing this in conjunction with connecting your diaphragm with your pelvic floor and understanding, right? So, you know, so that's that side. Certainly people just thinking it's all about sort of minimizing in a compressed look, that can do a lot more harm than good. And there's consensus across the board on that, right? So that is one thing. The other thing I would say is we have to remember that a cesarean birth isn't a cesarean birth. So you could be in a situation like I was, where I met my OB when I was 16 weeks pregnant, and he basically said, it's nice to meet you. You're having a cesarean, you're having twins, right? And to be honest, at that point in time, I was, okay, like if that's what the protocol is for twins, I would probably handle all of that very differently now. You know, my children are 10 and a half. But at that point in time, so I mean, I went into that situation feeling kind of like pretty prepared, feeling very at ease and safe, you know, and feeling really kind of in control, right? So actually, I recovered really well. There was no issue. It was fine. That's very different than someone putting a lot of work and effort and thinking and energy into having a birth a particular way, laboring for 40 hours, pushing for 4, and then going into an emergency cesarean situation. It's you can't even really compare them, right? And so you can appreciate in that other scenario, I mean, there's going to be other things that have happened downwards to the pelvic structures that wouldn't have happened in my situation, right? So I think too, it's also, and they're also, in fairness, anytime we know that there has been a feeling of loss of control, that correlates highly with sort of a presentation of trauma in the tissues, right? Like the data shows it, our clinical experience shows it. So again, the brain and the nervous system are going to be reacting after the fact very differently to that situation. So there's like many of things that we have to kind of consider. But I would say in a situation like that, where there was arguably already a lot of kind of downward force through the pelvic floor, I mean, that would be a scenario that especially you wouldn't be wanting these corsets. You know, it again speaks to why a compression short would be good, because then you're going to get the support into the pelvic floor. So that's probably what I would say about that. And that's probably going to lead to even more questions.
Well, one thing I find very common is some people do want a little bit of compression to help with pain management as they're moving and moving around. Is there any kind of wrap that you think is support, like that is beneficial if done properly?
I would still say the compression shorts, because they come right up to the ribs and they're designed for that.
Okay.
to make you feel a little bit more supported. They do have that medical grade compression in them.
Yeah.
So they're doing all those things.
Okay.
So yeah, that's what I would suggest. Like if you feel like
Okay.
you're going to want something, and there is, as I said, data to show that that can improve recovery.
Right.
I think that's reasonable. It's not going to say that everyone is going to benefit from that. No, but actually the most recent publication indicated that it translated to less incidence of diastasis. And
Wow.
so again, and that was that most recent publication.
Hmm.
So again, I think, yeah, probably until we have a really good reason not to use
Hmm.
really good quality, correct garments like that,
Yes. Yes.
probably there's more reason to let people know about them, to make sure they
Yeah.
know about the difference between a sort of corset garment and a
Yes.
proper compressive garment, where my
Yes.
bias is definitely the ones from bottom to top.
Okay.
And I think that could be actually a really useful strategy for people going forward.
Well, and probably really comfortable because they can keep it wearing it while they're laying down, wearing those giant maxi pads, and like it would just be very conducive to what they're already, wearing those first couple of weeks postpartum.
Well, and one of the comments, because actually there was a Canadian brand of a wrap system that I
Yeah.
used to recommend a lot, because again, it was designed with flexible fabric, which is what the data shows is good. So it really
Yeah.
was following as much evidence-based principles as possible, making sure it was flexible to lift up from the bottom and just
Yes.
provide some gentle compression across the front. But
Yeah.
a lot of the feedback we got from clients was anytime they went from sitting to standing, it would all shift around and they'd have to kind of
Yeah.
take it off and put it on again.
Right.
And so we then just have a practical issue, right? Whereas
Yeah.
the shorts, they're shorts, they perfectly
Yes.
stay in place.
Exactly.
So, it's just another pragmatic um, reason why, I think that tool, until we have good data that there's something even better,
Hmm.
there's a reason
Yeah.
not to use them. For
Yeah.
right now, I think we have really good reason to make people aware of a product like that.
Yeah. So there's different degrees, definitely. Like I think if someone's insisting that they wear some kind of a wrap, even if we're suggesting the shorts, the compression shorts, then there is other brands out there rather than something that squeezes you in. Look for something that has more of a lift up approach rather than just kind of coming in and squeezing, right? Because
Absolutely.
it comes down to preference too. And I did use that wrap similar to what you're talking about after my recent delivery last year. And because my stomach was so much larger after having my first, I found it not as comfortable because I had so much of like a belly fat. So I just didn't find it comfortable. It just didn't feel comfortable. So I ended up not wearing it. But I definitely will look into the shorts because I love that idea and I didn't even think of it myself. But in regards to pelvic health, because you're talking about the different types of cesareans, you have a planned cesarean, or you have an emergency cesarean, or potentially someone with laboring for 40 hours and pushing for 4.
Right.
That's a lot of changes in the pelvis going through labor and then the pushing phase. When we're talking about the pelvic floor healing and with trauma, what do you find is really common that people are coming in after having a cesarean into your practice? Like, is it like a lot of tightness and they're leaking urine, they have painful sex, like all these different things that people don't know about that can happen? Maybe you can let us know.
Yeah, I would say it's sort of the two things I see the most in practice are actually the things that align again with the evidence, right? So it's kind of nice when you can sort of see them come together. But one thing that women, I think, are not expecting after a cesarean, and I will say this was my experience too, is dyspareunia, painful intercourse.
Yeah.
They are thinking, particularly too, if they didn't go through like a long trial of labor first, like maybe they started off that way a little bit, but it was evident early on that just things aren't clicking along, right? So they're thinking, all right, well, my pelvic floor, my perineum, my vagina should be fine. Like, why is this so difficult? So I think that's one. And then it's a matter of us helping them to understand how the endopelvic fascia is pulled and actually getting them to kind of touch their scar, but then kind of touching inches below their scar and inches above so they can really feel how tight all that fascia is. So they kind of get it to understand that, everything in there is going to be really, really pulled. So it's going to be more sensitive, right? So that's one. But then the other one is stress incontinence, even if it's mild. And again, I think some people are thinking, well, I assumed that my pelvic floor would be okay.
Yeah.
So I'm kind of caught off guard that it's like 6 weeks later and I'm still, and it's not a lot, but it's even a little
No.
bit of a surprise. And again, it's helping them to understand that, look, the pelvic floor, for it to do its job, it needs to be fully responsive. And
Right.
when it is held tight, it cannot be responsive. It's like in a straitjacket.
Yeah.
So if you move too quick or whatnot, and it can't sort of respond and function and lift and coordinate, right? Because it's
Yeah.
just bound down.
Yeah.
And so again, I think this is surprising to people. The good news is it's relatively straightforward for all of us to kind
Yeah.
of work with these people and address it, which is
Yeah.
great, right? But I'd say those are the top two. And then kind of later on, then the diastasis seems to be more of an issue with these folks. And this is again
Yeah.
why it's great when we're working with them like right away, because
Yeah.
we can hopefully be doing lots of things to optimize load transfer, to optimize intra-abdominal pressure
Yeah.
management, and actually prevent a lot of that unnecessary assault of those tissues in the fourth trimester as they're trying to heal.
Right. Yeah, and I know people want to get back to feeling with themselves again. They want to get back to life. They want to get back to being intimate with their partner, being able to lift their kids without any, body pains or symptom of pelvic floor dysfunction. So how soon can someone come to start seeing a pelvic physiotherapist
Yeah,
postpartum?
so I always see my clients 4 weeks postpartum.
4 weeks? Okay.
So 4 weeks is when the majority of soft tissue healing, like for anything,
Yeah.
happens in about 4 weeks. We always say kind of
Yeah.
4 to 6 weeks,
Yeah.
but the bulk of it is sort of 4 weeks. And so the reason why I like to see my clients at that point in time is that way if something kind of comes up that I think might be a really important thing for them to have a conversation with their OB
Mhm.
or midwife,
Mhm.
they've had a chance to see me first rather than
Yeah.
having a visit with their OB. It's like a 5-minute visit. They didn't really feel like they really got to voice concerns, or maybe they were just so unaware of something that might be a good question to ask based on where
Yeah.
things are at. And then they're seeing me after and they're thinking, well, now I'm kind of discharged from care. And it's
Yeah.
right. So I find because so much of the healing happens in the first 4 weeks,
Yeah.
that's a time where, yeah, I can do an internal exam, no problem, unless there's an extenuating circumstance and there's a reason why it's evident that we probably should wait a little bit longer, or the individual is just feeling like they're not ready, but there's so many other things I can do in that visit, right?
Yeah.
That is a really good time. I would say most pelvic PTs would be saying, yeah, between 4 and 6 weeks after, again, that soft tissue healing time, that's a
Yeah.
good time for us to come in, because we don't want you waiting so long that by the
Yeah.
time you've seen us, now you're out of the fourth trimester. And it's not to say like we've completely missed our opportunity, but it really is such a powerful time of
Yeah.
recalibration
Yeah.
that if we can start nudging the system in the right way, we just have more potential to kind of steer it to more optimal healing in that time.
Yes.
So again, if we're seeing people sort of 4 to 6 weeks, we're at least kind of getting kind of 6 to 8 to kind of 10 weeks of that, right? To have
Yeah.
some input in that.
I love that. So making pelvic physiotherapy a part of your postpartum plan in healing, and booking your appointments maybe while you're still pregnant, especially if you're having a planned cesarean, so that you already have it in the schedule. You know that you're going to that, and you know what to expect. If you do have an emergency cesarean, you're booking that as soon as you get home from the hospital, because sometimes it's a bit hard to get into some pelvic PTs. I find you guys are so busy now
Yeah.
getting referrals from doctors that you just want to make sure that you're getting into as soon as possible to start getting care.
Yes.
Like you said, it's most beneficial. So I love that. That is such great information, because I just feel like you said, there's so many myths about, cesarean recovery and what that looks like and what we should be doing to recover. And, I have patients that want to get back to running and weightlifting, and they are afraid to do these things because, what if I, re-injure myself, or what if this symptom I'm having gets worse? And really, the empowerment comes from just sharing the information, whether it's parent to parent or practitioner to practitioner. I think that information needs to be given into the hands of these moms so that they know what to do, and there's a plan, and that they're supported, and it's not just a quick 5-minute postpartum visit for you if you don't have a midwife, and then now you're left off to fend for yourself and figure it out. So I love that information. Where can people find you if they're looking to get in touch with you?
Yeah, so as I said, so I work out of the womb in Burlington, Ontario. That having been said, I am the director of pelvic health. So I basically mentor every single physio that comes through the womb at every single site. They get the benefit of mentorship from me. So we have a really,
That's
really
awesome.
great team. But me, I am at the womb in Burlington. That's where my practice is. I have my Instagram page that is very much a professional page. It is very much, it's not a personal page. It's very much, again, like trying to translate the knowledge.
Yes.
So my Instagram page is Dr.Sinead. And then, but probably the easiest way to find me really is through the womb. I have my own sort of director webpage. I have a lot of my research on there and my blogs and interviews and podcasts and everything kind of on that page. So that's probably the easiest way to find me, is either on Instagram or on the womb page.
Oh, that's so amazing. I could talk to you for hours, but I know you're a busy person. So I don't want to take up too much more of your time, but I really appreciate the information. And like I said, knowledge is power. And I think the more we share, the more we can help people. And that's what it's all about. So thank you all for joining. And if you do have any questions, post them below and we'll try to answer them once this has been posted.
Okay, amazing. Thanks, Nicole. It was
Have
awesome to talk to you. Okay,
Thank you.
bye. Bye, everybody.